We are using a lot more energy than our focused shock, or our radial shockwave. So we do always want to keep patient comfort level in mind. Hey everybody, this is Mike from Kalkstein Chiropractic, your local Towson, Baltimore area chiropractor, back with another focused shockwave video. We've got a patient here today who's been having some chronic acute tearing in both the glute min and glute med. Been dealing with it for a while. Patients are regular with dry needling, with radial pulse shockwave. So for today, we're going to give the focused shockwave a try, and we should really see some more results because the area that we're treating again is that glute min, glute med region. So kind of right in this strip here. It's a very deep tissue, so we're going to really be able to get to the core of our problem today using our new fun tool that we have at the office. Without further ado, let's go ahead and begin. So let's keep the pressure right here, and you just let me know once anywhere starts to jump out at you. Right there? Gotcha. You want me to turn you down a little bit?
I can tolerate it for now.
Perfect. And so when we're dealing with tendinopathies in the in the focused shockwave, we do want to go about a week between treatments. Just especially when you're dealing with muscle fibers and tendons, you want to avoid any sort of fraying, because obviously if you end up fraying that tendon or that fiber, if it ends up getting loaded in any sort of capacity, we're at the risk of then tearing, and so we want to make sure our treatments are about that week apart. We're dealing with much more energy and at a much higher output with the focused shockwave than we are with the radial pulse, and so the treatments have to kind of nod to that as well. So as we've been saying before in the previous videos, the focused shockwave is a lot deeper. It's not as much spread out. We're kind of needle pinpointing the exact spot of our problem. And so there is a little bit more of a kind of general scanning until we find that area, but then once we find it, the patient's body and the patient themselves will really let you know, like, oh, there it is. And we're still getting that same desensitization after about 30-40 seconds of an area. And what you'll kind of find is that deep, dense kind of pain or ache that you're experiencing sort of dissipates to a more generalized, wow, that's kind of spreading out, and just my hip in general feels a little sore. So we're now exploring the anterior angle. I'm going to turn you down just a tad bit. I can see that was a little too sensitive. Is that a little bit more tolerable now? Looks like we're a little better. Perfect. So again, we are using a lot more energy than our focused shock, or our radial shockwave. So we do always want to keep patient comfort level in mind. So we're just playing with the angle that we're attacking, not only as we're moving across the muscle, but we're really just trying to send that, like I said, very needle thin kind of line of energy into the right part of the muscle, or the right part of the tendon, whatever our focus or target area is. Right there is still another sweet spot. That's perfect. So we're about 2/3 of the way done with our treatment. The focused shockwave treatment and the radial pulse shockwave are about 4 minutes long, so we've just kind of hit our essentially 1,000 pulses, and the device then tells us, hey, check in on the spot that you're hitting, check in on the patient. Again, the number one concern that we're always thinking about is patient comfort. So we do still have a little bit more on the treatment, but At this point, we just kind of check in with the patient. I know our patient right now is doing pretty good because we've been kind of communicating with each other throughout the video. So we're going to go ahead and finish our last about 300 pulses that we have here. So we've got about maybe another minute left on our treatment. And then we will kind of talk with the patient, not on camera, but just talk in general, get a good kind of feedback, kind of see what the differences were between the two. But so far today, we've gotten a lot of really good responses from our focused shockwave. It's the first day our office has the focused shockwave, so we're really having some fun with it here in the office. And that is the entire treatment. So again, not too long of a treatment, but it's just enough in terms of energy and output. Again, we don't want to send anybody here feeling worse than they did when they first came in, or a couple hours later as that soreness starts to come into effect. So again, the whole treatment behind Shockwave is we're breaking down the cells. We're breaking down our targeted area so the body can not only heal it back faster, but also that we can bring in a little bit of PRP, a little bit of fresh oxygen, fresh blood cells, and even stem cell ends up in the area of our targeted spot, just because the body does treat this, just like the radial pulse, as a trauma, and so that's going to be the natural response. Along with that rebuilding is all of those good healing factors coming in. All right, everybody, this was another focused shockwave video. I'm Mike down from Kalkstein Chiropractic. If at any point in time you want to come in, try out our new toy, get some dry needling, get some radial pulse shockwave, or even just get an adjustment, come on by. We're your local Towson, Baltimore area chiropractor.